Hey everybody, Dr. Schultz from the Centeno-Schultz Clinic with another weekly update. Thank you so much for checking in. Today we're going to be talking about the cervical spine, the neck. And in particular, I'm going to be reviewing what is a cervical radiculopathy, otherwise known as a pinched nerve in the neck. So let's get started, and thank you so much for checking in. So the goals of this presentation are to review what in the world is a cervical radiculopathy, some basic anatomy so you can understand, and then what are the major 8 causes of cervical radiculopathy. So a cervical radiculopathy occurs when there is an irritation or compression of a nerve in the neck. And the symptoms are burning electrical pain down the arm, and it can even extend to the hand. Patients can also have numbness, tingling. They can also have pins and needles. And then in really advanced cases, they can have weakness where it's very hard to even pick up things. So a cervical radiculopathy is just a medical term for a pinched nerve in the neck. And this is the anatomy we're going to review. The cervical spine is made up of some vertebral bodies, the bony building blocks that make the spine. And they're labeled here. There's C2, C3, C4. And then sandwiched in between each of them is a cushion, otherwise known as a disc. And again, this is a frontal view here. And then at each level of the cervical spine, a nerve comes out, a nerve that travels to the tissue or muscle that it's intended to provide information to. Now, this is a side view. Again, this is the building block. Let's just say this is C5, and this is C6. And then sandwiched in between them is the disc. And then this is the doorway through which the nerve comes out. And you can see that that doorway can be compromised. And that's what we're going to be talking about today. So the 8 major causes of cervical radiculopathy. The number 1 is obviously an injury to the disc. Now that may be a protrusion, a herniation, an extrusion, but it also can be just simple degeneration. And if this is a normal disc, if it gets injured, it can come back in here and injure, compress, or irritate an exiting nerve root, giving rise to that numbness and pain going down the arm. Number 2, trauma. That seems to be an ever-increasing event here in the Denver area, and I hope it's not the case in your community, but a car accident, athletics can injure both the nerve fibers as well as the disc. The third cause of cervical radiculopathy is called facet arthritis. A facet is a small little joint. It's on the back side of the spine, and it, like other parts of the spine, are subject to injury and degeneration. When this does get arthritic, it can bulk up and narrow the pathway through which the nerve is coming out, giving rise to that pins and needles. The next one is cervical fracture. Here's an illustration. As this vertebral body at C4 was fractured, it got displaced and compromised both the spinal cord and the exiting nerve roots. The next one is an important one, and it's ligament overgrowth. Now, ligaments are connective tissue that connect bone to bone. They provide critical stability, but they're also subject to irritation, damage, degeneration. The one that's most common in terms of cervical radiculopathy is this ligamentum flavum. It lies in the back side of the central canal, and when it gets bulked up, it can actually narrow the area through which the spinal cord and the exiting nerve roots exit, giving rise to irritation or compression. The next one is a bone spur. You know, those abnormal bone growths? Well, they can occur in the neck, and here's a great illustration. This is a cross section. This is the spinal cord. This is the doorway through which the nerve exits. But you can see there are these abnormal growths of bone that have irritated and compressed that nerve, giving rise to a pinched nerve sensation. The next one is cervical misalignment. All the vertebral bodies are intended to stack one on top of the other, just like the drawers in your kitchen. But due to trauma or other conditions, you can have a condition where one of the vertebral bodies slides in front of it, or it slides in back of the other vertebral bodies, and that can give rise to irritation or compression of the nerve, giving rise to a cervical radiculopathy. And then stenosis. Stenosis is a medical term, basically, that describes narrowing. Just like this hose, you can have narrowing of the central canal or narrowing of where the nerve exits the spine, giving rise to irritation of the nerve. So hopefully you understand that when someone says you have a radiculopathy, it's basically a pinched nerve. There are 8 major causes of cervical radiculopathy, which I review. If you or a family member have or are ongoing pain and you're on the sidelines as a result, consider an evaluation by the Centeno-Schultz Clinic. Why? We have 17 years of clinical experience with regenerative treatment options. We have board-certified fellowship physicians who evaluate and provide all the treatment. And in addition, we have a flexible platform that allows for dosing. That's right, dosing of PRP. Not all PRP is the same, so know that there are critical differences. Thank you so much for checking in. I'll see you next week.